Welcome, everybody. We will be getting started shortly. But while we're waiting, if you don't mind putting in the chat, tell us where you're from and where you're joining us from. We got a fellow Camels person. Hello, Philip. Hello, Carmen. Welcome. Pennsylvania, Detroit, Cincinnati, Lebanon. Okay. Florida. Oh, this was Beirut, Lebanon. Great.
You have like New Hampshire, Lebanon, and Beirut, Lebanon. I love that. And like three away from each other.
British Columbia. We have a nice crowd from all over. Welcome, everybody. All right, so we are at 12:01 Eastern time. So I'm going to go ahead and get started so we have plenty of time later on. So good morning, good afternoon, or good evening, depending on where you're joining us from. My name is Kelly Bryant, and I have the pleasure of being the chair of Society for Simulation in Healthcare's Communications and Media Committee. And today, to start off Simulation Week, we have a great presentation by the president of Society for Simulation in Healthcare, Dr. Haru Okuda. So I will give a brief bio about Dr. Okuda. He is currently the executive director of USF Health Centers for Advanced Medical Learning and Simulation, also known as CAMLS, and he oversees this 8,400-meter advanced medical simulation training facility. He also serves as the CEO of USF Health Professions Conferencing Corporation, Associate Vice President of USF Health's Office of Interprofessional Education and Practice, and Professor Morsani College of Medicine, and he's still a practicing clinician in the emergency department at Tampa General Hospital. He is a fellow of the American College of Emergency Physicians and an inaugural fellow of the Society for Simulation in Healthcare Academy. And as stated before, he is currently our president. So without further ado, I do want to introduce Dr. Haru Okuda, who will be presenting today on striving for excellence in advocacy and simulation. So as you're listening, I just want to make a note, please. We want your questions at the end. It'll be about a 20-minute presentation, and then we'll have 10 minutes for question and answer. So please feel free to put your questions in as we go along, and we will address them at the end of the presentation. Handing it over to you, Dr. Okuda.
Great. Thank you so much, Kelly, for the great introduction. I appreciate it. Happy Healthcare Simulation Week to everybody from around the globe. And as we saw in the chats, really a wide representation of our members and interested folks in simulation. I also saw, or we saw that Asit was on earlier, who helped moderate the first of many presentations for this week, I think at 3 a.m. East Coast time. So appreciate you doing that, and hopefully that session, I heard it went very well. So it's very exciting. So we have about a total of about 30 minutes together. I'd like to spend about 20 minutes talking about the topic, and then hopefully open it up for questions. I will be straight just honest with you that I'm not an expert in advocacy. I haven't had formal training to be an advocate, but I think we could probably all agree that everybody on this presentation, you're all advocates. And whether you advocate because you want to have better learning experiences for your learners through experiential learning, such as simulation or mannequins, task trainers, standardized patients, or simulated patients, or you are an advocate because you want to improve patient safety or quality within your organization. We are all advocates. But as I've recently taken on this leadership role with SSH as president, but even before then in roles that I had with the Department of Veteran Affairs and the New York City Public Health System, I realized how important it is to advocate, and that maybe it would be great for all of us to be more purposeful in our day-to-day advocacy. And I think oftentimes we have this 5,000 member organization. We often do advocate, but we're advocating to each other. And my hope is over the coming years, maybe this is the decade of advocacy and really engaging people and convincing people outside of our uh, uh, tribe, our simulation tribe, about the value and importance of healthcare simulation, and whether that's within your school, your college, your hospital system, or even beyond. I think it's all up to each one of us to do our part in advocacy. So that is an introduction. I'll start with no disclosures, and I'll start with just sort of what is advocacy. And so if you look up the definition, public support for or recommendation of a particular cause or policy. So it seems pretty straightforward. You have some passion for something, you believe in a cause, and you really get behind it and try to move that agenda forward in the public space. And there are types of advocacy, which there are three. And the first one is self-advocacy. And I think that's probably the one that hopefully all of us have done at some point in our careers and continue to do so. And this refers to an individual's ability to effectively communicate, convey, or negotiate your own assertions or beliefs, desires, needs, and rights, right? So this is self-advocacy. You're trying to promote yourself, whether it's your career or some other reason for advocacy. Individual advocacy is a little different, and that's a person or a group of people that are concentrating their efforts of advocacy on behalf of somebody else. And it might be one, two, or a small group of individuals. And that's individual advocacy. Maybe an example of that is as you get more senior in your career, you are trying to help more junior faculty or colleagues, or maybe it's a new simulation operations specialist, and trying to help them move up the ladder and get promoted. And so that's individual advocacy. And then systems or community advocacy is when people work to change what happens for a whole group or a community of people. And so specifically, health systems advocacy aims to make positive changes to attitudes, policies, systems, and laws in the health arena. And I think you could include for health simulation advocacy, it's trying to make positive changes in attitudes, training programs, policies, systems in healthcare education and patient safety. So if you think about advocacy, and I ask you to think about, who you advocate for, or initially what you're advocating for. And for me, it's my whole career in simulation started because of an error in training, a medical error that I was a part of, and I wanted to really figure out how to change how we taught our future physicians. And so simulation was that modality. And so patient safety is my area, but it might be students. You might be advocating and saying, you know what, I'm tired of teaching didactics only and clinical bedside. We really need better opportunity trainings, a safe learning environment for students. And so you're advocating about training and education, or as I said earlier, maybe it's to help promote somebody from because you believe in their cause, or it could be advocating for technology, or as I mentioned earlier, your own self to help your career grow. If you get passed up by other people, you have to really start advocating of why you deserve to be in another role or move up the ladder. Or maybe you're advocating for a group of individuals from underrepresented groups in healthcare, and you really want to expose that group to the possibilities of healthcare education. And the list of the what goes on and on and on. And I'm sure each one of you have at least one that you're passionate about that you probably don't even realize, and that you are an advocate. So then beyond the what, it's to whom. And for me, it's been different whom's over my career, about 20 years in simulation, but just looking at the pictures it could be a philanthropist, right? So maybe you're trying to convince a philanthropist about the importance of simulation for patient safety, and that, why is it important to donate funds to help start up your simulation center. The next picture from the top left is with a green tie is my boss. So he is the dean for the College of Medicine and senior vice president for USF Health. And so in your situation, maybe you're advocating to your boss about your career. It could be about building or creating more programs for the college, school, or a training program. So that might be your individual, or it could be a politician, whether it's state or local or federal, to really impact change at a higher level, maybe get state funding or federal funding, and then continue to move around. It could be a committee. It could maybe more than one person, but it could be a committee that you need to go to help implement some training. Or it could be, if you recognize the gentleman on the left, it could be your neighbor. So we don't necessarily have to advocate to leaders or bosses, but just advocating to your patients or the lay public about the importance of simulation, and that they should be demanding simulation from their healthcare workers and providers, that they go through it, and asking the question, have you gone through central line training before you get a central line placed in you? Hopefully you'll never have one, but having people demand it from their healthcare professionals, or it could be your patients as well. So those are the two whoms. And as you've thought about your what, if you haven't already, think about, who you need to advocate to, or what groups of individuals, in order to achieve your what. And again, many of you are probably experts already. General tips on advocacy. So you really have to understand the issue at hand, both sides of the issue, both the pros and cons of whatever you decide. Remember that you're not alone. Find others that agree with you, join in. I think the society has lots of colleagues that are willing to help support and push the agenda, build alliances in the wildest sense. So maybe these are not simulation people, but they're interested in the same end goal, whether it's a safety goal, maybe it's a central line issue, maybe it's a training goal, maybe you're trying to increase the ranking of your organization. And so get other stakeholders that are willing to say, hey, I'm going to go, we'll partner together in this effort, the long effort to get to the endpoint that we're trying to do. But also know who your opposition is. And the opposition, they're not necessarily bad people, but they have other priorities. Maybe it's the CFO that say we just don't have any money, or other organizations or individuals, and just know why they might say no. That's to me more important than knowing all the reasons why it's important. And then you want to set clear goals and expectations. What do you want to get? What does success look like? And finally, developing an action plan and a time schedule for whatever you're trying to achieve. So I'm just going to give a few examples. And again, as I mentioned, I'm not an expert, but I've done this quite a bit over my career. So when I first started my career, I was at Mount Sinai in New York, emergency medicine. And I loved education and training, and I wanted to teach medical students. And I also and residents, but I realized that, maybe the traditional way that we've always done things was not great. And so I had to figure out, and I heard about this thing called simulation, but we didn't have it in our department. We had no money for it. And so I really had to figure out, how do we expose simulation to our residents? And so I went to my chair of my department. I said, look, I think we could do this better, try to get his buy-in. He was very supportive, and he said, okay, let's see what we can do. Find some places that are doing it really well. And so he sent me up to the Brigham and Women's and Mass General, Brown, a few other places that were already getting into simulation in 2000. I learned their best practices, their why. So again, this is me researching and understanding why it's important, because I knew at face value it was important, but I didn't know why. And so they helped. I learned a lot, and they became resources for the future. I also fortunately had a local simulation expert, Adam Levine, and I sought him out and said, hey, look, can you come on board? We really want to, even though you're anesthesia, and I know it's your simulation center, can we utilize it? And ultimately, through these levels of advocacy, we were able to build and start a simulation program for our residents at Mount Sinai. And so again, it was, the why, the who, finding out information, getting resources, and ultimately setting some timelines and starting to implement the program. So that's more on a local scale. My next part of my career was at the New York City Health and Hospitals Corporation, which is a 11 city hospital system. It might even be more now. It's been a while since I've been there. And multiple trauma centers, many underserved populations. So there's not a lot of money at hand for the New York City Health and Hospitals. And they were building a simulation program to support the health system. It needed to be successful, and I came in as a director, and the organization reported up to the chief quality officer and the safety officer. And so their focus around patient safety, which resonated with me. And so we needed to figure out, or I needed to figure out, what's an early win for simulation. This is in 2000, this is over 10 years ago. And so again, doing the research, how do we get buy-in for just simulation in general? We wanted to find something that people valued, that was going to show an impact, and that we had issues within the organization from a safety standpoint. And so Central Lines was a good topic to choose. I convinced my boss, he supported it, but the challenge is, again, you have 11 hospitals, you can't force them to do it. And so you needed to find a champion that was willing to take the leap of faith to say, you know what, simulation is better than how we always did it. And so I went around and talked to different chief medical officers at the different hospitals. And I came across this gentleman, Dr. Wright, who was the chief medical officer at Harlem Hospital. He said, you know what, it makes sense. You have the program, you're going to bring the training. I will make sure we get our physicians and APPs through it, and I'll require it for the hospital. So we were able to implement central line training at Harlem Hospital. This is actually a picture at Lincoln Hospital. I believe I have a picture of Harlem Hospital one, but it was just not as pretty because it was dark. But you got buy-in. And once you start getting that buy-in, and these are non-simulation people, but when you are able to show the vision and get their buy-in, then the other simulations, hospitals and healthcare hospitals come along as well for the ride. In my last position prior to this position was with the Department of Veteran Affairs. We have over 100,000 clinical providers within the system, 150 medical centers. Again, similar thing, we were building a brand new simulation center and we needed an early win. And so this one was a sort of circuitous route. It's coincidental and was fortunate. So there was a out of OR airway management directive, and directive is almost like policy or law within the Department of Veteran Affairs as healthcare system. And this original directive, I think, was in 2011 or 12, and they were revisiting it, revising. Oh no, I think it was earlier than that. They were revising it in 2012, and it was airway management. And so what better type of training for and there's no simulation requirement in the past. And so, was there an opportunity here to incorporate simulation as a requirement across the entire VA system for airway management? I met with the national director for anesthesia, who was responsible for this directive. And again, understanding the gaps, the system issues, we worked together and he agreed to incorporate a requirement for simulation within the directive. And that was huge because now 150 hospitals are required to assess and train their doctors and other respiratory therapists on mannequins. And we were able to build a national program, and that actually launched our national training program, buying high fidelity mannequins for every VA medical hospital in the VA. And so we were able to buy a bunch of mannequins. We launched our first URAM training for clinicians, and that was very successful from that. But again, it's finding the gap, knowing your champion, convincing them through their data and your data, and then coming up with an action plan, timelines, and really moving it forward. Currently at Camels, we're at 20 minutes, so maybe 2 more minutes. I came to Camels about 4 years ago. Obviously, you know what happened between 4 years ago and now. This was, watching my colleagues up in New York City really struggling with COVID early in the surge, just back in March, April, May, and anticipating that there'll be a surge down in Florida. And we said, what can we do? And reached out to our chief quality officer at the hospital and said, we really want to be there to support. And again, simulation, they didn't have major simulation capabilities. We were the academic partner, but we were able to convince them. And so we did, this is early on when we were trying to figure out how the best way to intubate patients were. And is it a bag? Is it a plexiglass container? We know all that wasn't very helpful now, but they were able to, they allowed us to come and then do training for teams for COVID management. And so again, finding the champion, convincing through data and research and best practices, and then coming up with the action and timeline, and then implementing it with clear metrics. So again, those are just some examples. Currently for the Society for Simulation Healthcare, as I became president in January, we formed a government advocacy task force. I think there's a great opportunity for the society to use their expertise, their reputation, and their voice to advocate for the use of simulation for training, education, patient safety. And so back in January, we stood this up. It's led or chaired by former president Bob Armstrong. And we've partnered with some big organizations like the National Training, the Simulation Association, and really trying to push the understanding, awareness, and the importance of simulation for patient safety and quality improvement. And we are reaching out to representatives in DC and trying to get funding in an appropriation bill and for FY23, and really convincing them why this is of importance to them and why they should get behind it. And again, if you have an opportunity to do this at the local, so city, state, or government level, even, whatever, if you're in the US or in your country that you reside, and if there are opportunities, if you're at the level where you have a voice or can partner with somebody like that, I highly encourage you to do that for the sake of our patients. And recently I joined, I'm very much, we at Camels are very much interested in the use of emerging technologies for training and education. And so I joined the Hall of Medicine Association. They're really focuses on virtual reality, augmented reality. And I'm a part of the policy advocacy working group because we need to develop standards around it. It should be global standards on what is, how we should be both implementing VR and AR for training, but also for clinical practice, and trying to be one step ahead of the game there. So, if you've never done an elevator pitch, I think it's a good place to start. That's, the idea of if you bump into this person that's going to be able to help you in an elevator, it doesn't have to be an elevator, and you have 30 seconds, what can you say to convince them to at least think about it and maybe reach back out or give you an opening to say, why don't you set up a meeting with my assistant and we can talk about it further. And so there are 3 components. First, you have to say, who am I? Why are you the one that should be speaking about whatever topic it is? And then what is the idea? Is it, we should be using more simulation for patient safety, or maybe we need to come up with a specific area around training for this organization. And then ultimately, what's my ask? I'd like to set up a working group to investigate this, or I need some funding, or something like that. And that is really it. So I think you are all probably incredible advocates. You're probably doing this every day, but I would like to maybe convince you to be more intentional and really think about what you're doing day to day, and then have a broader plan for your advocacy agenda in healthcare simulation. With that, I thank you and open the questions.
What a great presentation. Thank you, Dr. Akuda. You really gave us some gems, identifying your champions. Obviously, that's a great first step. Using research and best practices, coming up with your elevator pitch, and also when you come up with your plan, having metrics to measure your success. So all great pointers. So I do have one question that came in. And the question is, how can one leverage something like Healthcare Simulation Week to start the journey toward advocating for a specific simulation project?
I think that's a great question. And I think what I like about Healthcare Simulation Week is it's not one person saying, no, simulation is really important, and you're the only cheerleader. There's actually a week dedicated, at least in the US it is, and I think, we can argue around the globe, focused around the importance of simulation. And so you can now bring this to your stakeholders to say, hey, what are we doing with simulation? There are all these, you find deans and hospital organizations are very competitive. And when you say, oh, these organizations are involved and they're really pushing simulation or demonstrations during Healthcare Simulation Week, can I get the resources to do that? Alternatively, you can use this week if you're trying to really demonstrate what simulation is. You can post that, posters and emails saying it's Healthcare Simulation Week, come down to our X and come take a look at our simulation center, and we'll tell you more about simulation. It gives you an excuse and a justification to do that. And I think that's a great first way in if you're an organization that's really still early in their journey. And then partnering with your stakeholder, right? So if you identified somebody that you really want to, need to get closer to get what your agenda is, to maybe reach out and say, hey, it's Healthcare Simulation Week. I know you're a really important person, but there are over 5,000 members of the society. There are over 100 places that are participating. I would love a little snippet, a little video snippet of your support of our organization and simulation that I can share on our social media. And if they're like, well, I don't know anything about it, I don't know what to say, that gives you an in to say, oh, well, let me tell you, come down, let me show you. We could interview you next to a mannequin. So I love this week. And I think it's a great, great tool to utilize for your goals.
And that kind of leads to the question I had for you. Money is always a major obstacle for getting your simulation initiative started. So I'm just curious if you had specific tactics that you use to kind of get that C-suite or the people that have the money interested in your simulation activities, especially if they don't really have a background or know what simulation is. Did you have any kind of open house or bring them into the simulation center and do any demonstrations? Like, what were your tactics?
I think demonstrations are really important. I think they need to have an awareness of who you are, what value you bring. And I would probably argue that even if the C-suite doesn't know about your simulation center, it's usually the first place they bring really fancy donors to tour the simulation center, whether you work in a hospital healthcare system or in a school. And so they need to know about it, right? And I used to use those situations all the time to stand next to the CEO or stand next to the dean and be like, in this wonderful simulation space that the dean or the CEO has really supported, we could even do more if we had more capacity or more space. So those are kind of things that you can do. But ultimately, even in the examples that I've shown, and I have many others, I haven't said, hey, you should give us money for simulation. What I've done is look to see what their pain points were. And usually if it's around safety, or maybe it's about rankings, we need to or recruiting more students or better students, and then understanding what that is, and then trying to figure out how simulation can fit into it and improve it. And then there's usually budgets allocated to these priority areas. And then you try to see if you can carve out a small amount to get your foot in the door to allocate for resources for those efforts.
Great. Oh, very good tip. And I also have another question sort of related to finance. What is your for someone who is looking to start a program, but not sure if there's funding support, or how do they get funding support?
It depends on the circumstance. I don't know if this is a school or a hospital or EMS or some other system. But just understanding what the priorities of the organization are really important. Many of us started with a shoestring budget. I borrowed mannequins, I pushed them on my own, I started it. I had to sort of demonstrate the value before I was given funding. And so that might be where you need to start, where you either, if you have partner organizations that have sim centers and you're able to bring your learners there to show how cool it is, and then they come back and say, well, we need this at our own simulation center. Or if there are some resources that you start doing things in situ, in classrooms, wherever you can to demonstrate the value.
Mhm. And also, you may want to consider partnering with other people who may be interested in simulation, sharing the cost of
For sure.
simulation space. I have another question. This is a good one also that I think we've all experienced. How do you overcome resistance to change to simulation? Going from the traditional way of education, and now we're trying to introduce simulation. Sometimes that's met with resistance. How do we overcome that?
Yeah, it's an interesting one. I mean, I think resistance can be at all levels. If you think in terms of more the sharp end, it's oftentimes either the clinicians not wanting, whether they're on the instructor side or the learner side. If it's on the practice side, it's the faculty not want to learn how to use simulation to teach, or it's often the clinicians that are like, I don't want to go through that. I've done it the same way I've always done it. If it's on the school or college side, oftentimes, again, if you have basic science folks that, are threatened by including, the inclusion of these types of immersive technologies in training and education, because, as we all do, we sort of protect our area. I think it's so important to be able to show them how they can augment their training. And it's not like you're trying to push them out and they're no longer going to be useful. But I think just demonstrating the value is really important. I've learned over my career that I don't focus on the late adopters. They will either, if the organization eventually moves in that direction, they'll either leave the organization or they'll come on board. My focus is really rallying around the early adopters that really embrace change and get them to talk about how great it is, whether it's on the faculty side or on the learner side. And then that will start, and after you get a certain momentum going, that'll start getting sort of the folks in the middle involved. But you also really have to bring the leadership, right? So if you're working in a department, let's say, my example, emergency medicine, the chair or the program director, they need to come and they need to see it and go through it and buy into it. And then other faculty will come along. And the last thing I'll say about the buy-in is, in my 8 years with the VA, and we had train the trainer at the National Center, we brought in physicians, nurses, advanced practice providers from all over the VA. Many of them were voluntold to come. So some of them were like, I don't even know why I'm here. I don't want to be here. Of the thousands of people we train, I think I just remember one that after training, they still just didn't buy it. But everybody else, all the ones that were pushing back, they got it after they've gone through it. So you just have to get them there.
Yeah. And that's what I would say. Get them in your simulation center, because you can talk about it, but until they're in there seeing it firsthand, that's when you make that significant impact. So unfortunately, we have run out of time, and 30 minutes went by so quickly. So I want to thank first Dr. Okuda for taking the time out and kicking off Simulation Healthcare Week with this wonderful presentation. And I want to thank all of you for joining us today. Just as a reminder, we have plenty more webinars for the rest of the week. If you look in the chat, there is a link where you can register and you can see the rest of our webinars for Healthcare Simulation Week. So thank you everyone for joining us, and we hope to see you at our future webinars.
Thank you all.
Bye, everybody.